Many people question whether or not to seek help for depression and when is the right time to do so. Well, Dr. Nate Upshaw of NeuroSpa TMS is back to answer some of those questions and discuss how they may be able to help. Good morning. Good to see you again. So let's start here. I think a lot of people are struggling with depression, but there is this big question of how do I know it's actually depression? When is it time to go seek professional help? I mean, there's a lot of variables here. Let's start there.
Yeah, so a lot of people have, general ups and downs in life, but what is concerning is when people are feeling down on a daily basis.
Okay.
And usually people have a sense that something's not quite right, and they should really trust their gut on that. Another thing is that a lot of times family members will also recognize when they are concerned that someone hasn't been themselves, and they should reach out to that family member and encourage them to get help.
So how do actually medical professionals, though, actually diagnose that you have depression?
Right, so depression is more than just a depressed mood. There's actually other physical symptoms like problems with energy, problems with sleep, problems with concentration. Then there's negative thoughts that are happening all the time, feelings of guilt. And you can actually capture these symptoms on a rating scale. You might have seen it at your doctor's offices where they screen for these questions. But it's very obvious to see that there's a clinical syndrome going on that would suggest there's been some changes in how the brain is actually functioning.
So there may actually be a checklist of where, it's pretty common, okay, are you experiencing this, and based, on your doctor's experience can go, okay, this sounds like we need to do something about it.
Yeah, so it's not as subjective, it's very objective. We're looking for several clinical signs that someone is having depression, which again indicates a clinical change in the brain's function.
Let's talk about treatment options, and this I think is where there's hope for people. We want to let people know that there is something you can do about it. Talk about treatment options.
Right, so everyone knows about psychotherapy, about taking medications like antidepressants, but what we do is we use TMS therapy, which uses electromagnetic pulses to treat the specific areas of the brain that are often out of sync with depression. And so this is a non-invasive, office-based procedure with no side effects. And it works, oftentimes better than medications.
Well, and we're going to show a chart here in a moment too, but talk about the results and talk about how it must be great to kind of be in this profession at this time and actually see that people are getting help.
Right, so this is a very exciting time in psychiatry because we have a brand new tool to treat depression that is more beneficial without the side effects of medications. And what we're seeing also is the results are much better. We use a screening tool called the PHQ-9, which measures someone's symptoms when they're coming in.
Okay, so here it is now. So kind of explain what we're looking at.
The one on the left, the person has almost all threes. It's a very symptomatic
It's like a rating scale of saying, this is how I'm feeling.
Exactly, which would indicate a severe depression. And if you look at the one on the right, after treatment, they have all zeros, indicating that their depression is completely gone. And I've been doing psychiatry for over 15 years, and we just don't get those kind of results with medications. So
as we get ready to wrap up here, I mean, how do you kind of best decide if, obviously one size isn't going to fit all, this may not work for everybody. How do you know if somebody is going to be a good patient for this? So
for TMS, pretty much anyone who's thinking about taking medications or has taken medications and didn't get the results they wanted or got side effects, they should really think about calling us and getting an evaluation to see if they qualify for TMS. And oftentimes their insurance covers the procedure as well.
All right, well, let's go ahead and put up your information because, again, I think this is relatively new. I think people are still finding out about this, but it's nice that there is another option that people can explore and look at and find out for themselves. There is the number to call. There's the website. Thank you so much. We appreciate your time once again this morning. We look forward to having you back soon.
Thanks for having me again.